Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and let's look at the advantages and disadvantages of having traditional Medicare versus Medicare HMO or Medicare Advantage plan. Here I have put together a PowerPoint presentation to show you side by side Medicare versus Medicare HMO or Medicare Advantage plan and see what the differences are. With the traditional Medicare, you have a choice of any doctor. You can go and see any doctor in the country for that matter. It is nationwide. With Medicare HMO or Advantage plan, only a limited doctors who are on the plan can see you. If you see a doctor outside the HMO or Advantage plan, then you have significant penalties. Let's talk about hospitals. With Medicare, you are covered nationwide. You can go to any hospital anywhere in the country and your Medicare would be accepted. Whereas you may have limitations as to which hospital you can go. There are a lot of hospitals in the city which may not take your type of Medicare Advantage plan, which puts you in a disadvantage because you may not be able to get all the services that you want because the hospitals which are approved may not have those services readily available. Now let's talk about authorization. If you have a traditional Medicare, you don't need any authorization. You can see any doctor you need. Whereas with Medicare HMO or an Advantage plan, you almost invariably need authorization to see a doctor, especially a specialist. Except your primary care doctor, any other specialist that you want to see, you need to get an authorization. Getting authorization is not easy. Most primary doctors have several Medicare Advantage programs on their list, and there are literally hundreds of patients who need authorization on a weekly basis. That puts an enormous amount of strain on the primary care doctors' offices to get authorizations, and without authorizations, the specialists are not going to get paid anything. So there is a tremendous amount of time and resources wasted in getting these things done, whereas with traditional Medicare, you don't require any such prerequisites. Referrals. Not only do you need an authorization to do tests as a specialist, we need to have referral from the primary doctor. If a primary doctor refers a patient to a cardiologist or a surgeon, they have to literally go on the Medicare Advantage website and get an referral number to send the patient to a specialist. All of this involves a lot of time and resources on the medical staff office, for which there is no reimbursement for the doctor's business. Let's talk about cost and payments. With traditional Medicare, of course, you have an annual deductible, which is approximately $150 for Medicare Part B, whereas Medicare approves a certain amount and it pays 80% of that, and 20% copay is your responsibility unless you have a supplemental insurance, which we're going to talk about in a minute. Whereas with Medicare HMO or an Advantage plan, you invariably have to make a copay. Every time you visit a doctor, it could be $25, it could be $50 to a specialist, it could be $65. That almost accounts for 50% of the office visit to a doctor's clinic. And these things can add up. And in the next slide, I'm going to show you how these things can add up. Let's move on to the next slide. Here, let's look at prescriptions. Medicare traditionally doesn't cover prescriptions, whereas the Medicare HMO or an Advantage plan covers most of the prescriptions, but at the same time, you still have a copay, and this Medicare Advantage plan may not cover all medications, and the copay you pay also could add up to the total cost per year for your healthcare coverage. Talking about total cost, let's look at annual cost of having a traditional Medicare versus Medicare HMO or an Advantage plan. With the traditional Medicare, you have to sign up for Medicare Part B, which may cost $160 to $175 depending on the year. And if you get a supplemental insurance, which is like an AARP supplemental insurance, or a supplemental insurance from any one of the insurance companies like Aetna, United Healthcare, Blue Cross, Cigna, Humana, or any one of them, that would approximately cost you $150 to $175. And from the same company, you can get a prescription plan, which is a much better prescription plan compared to an Medicare Advantage plan for about $50 to $60. When you add up all these total costs and multiply that by 12 months, it may come to approximately $4,800 or roughly $5,000. And the Medicare HMO or Advantage plan may say you have zero premium. But don't be misled by this zero premium, because your copays and office visit pays, deductibles, all of this can add up, especially if you have multiple medical problems and you're entering your Medicare insurance status with pre-existing multiple problems with numerous medications. Then think twice before you consider Medicare HMO or an Advantage plan. All of these costs can add up to a substantial amount. So the annual cost from your out-of-pocket expenses is capped at $6,700 per year with Medicare HMO or an Advantage plan. Now, comparing these two costs, you need to keep in mind what are the things that you are giving up. On one hand, the Medicare traditional plan with full coverage with supplemental insurance and prescription plan may cost you approximately $5,000. Here you have the choice of doctor, you have the choice of a hospital. It is nationwide and you don't need any referrals, you don't need any authorizations. Whereas with Medicare HMO, if you have multiple medical problems and your cost is already reaching over $5,000, then you have no benefit. In fact, your Medicare HMO or Advantage plan could be quite restrictive in terms of selection of doctors or hospitals. And don't forget that you have to get a referral, and for every test we need to have authorization. Otherwise, nothing is going to be done. All of these add time, energy, and tremendous amount of resource on your part and on the part of the staff at the doctor's offices. Medicare, you need to enroll in a certain period between January and March. If you don't enroll in that period, you can still enroll, but there may be a penalty and interest. Whereas you can switch from Medicare to a Medicare Advantage plan at any time, usually at the end of the month, but you need to be prepared when you come from a Medicare HMO or an Advantage plan back to Medicare. You need to do a lot of research about your Medicare supplemental insurance and prescription plans before you switch, so that there is no discontinuity in coverage for your medical conditions and especially your drugs. This is especially true if you have multiple medical problems to begin with, which needs constant monitoring and supervision. Of course, with Medicare, you have to deal with all the paperwork in relationship to the claims from all the doctors and hospitals, whereas the paperwork is much less with Medicare HMO or an Advantage plan. Medicare is a nationwide network. You can go anywhere in the country, you can see any doctor, and you can be admitted to any hospital. Whereas most of the Medicare HMOs are local, a lot of them are very small, and they have limitations. In a nutshell, which is the best plan? It is an individual choice. Because if you look at cost alone, you remember that there is cost involved with Medicare and there is cost involved with Medicare HMO and Advantage plan. So the hidden cost may not be evident when you sign up, but when you start using your Medicare HMO or Advantage plan, then you will begin to understand. Especially if you are entering into the Medicare age with heart conditions, diabetes, hypertension, and you're on 6 different medications, then you need to seriously think about what your total cost is going to be being on Medicare versus a Medicare HMO or an Advantage plan. If you are healthy and if your crystal ball says that you don't need any medical care that is substantial in the next year or two, then a Medicare HMO or an Advantage plan may seem very attractive because the initial cost is considerably less. But for that, you're giving up the freedom of choice as far as doctors and hospitals are concerned. Again, you have to put up with the stress of getting authorizations and referrals. On the other hand, if you already have multiple medical problems and you're already spending a substantial amount of money on your medications and doctor's visits and tests, you consider the total cost per year if you're on a Medicare Advantage or a HMO program and how it compares to when you're on a traditional Medicare with Medicare supplemental insurance and a prescription plan. When you add up all these things, then you will be the most knowledgeable person to decide which one is the most suitable in your case. Well, ladies and gentlemen, that is in a nutshell an overview of the pros and cons of having Medicare or a Medicare Advantage plan. It is only you who can add all the numbers and decide which one is best suitable for you. I hope this has been useful to you, and thank you very much for watching. And if you are stressed out, I would suggest you can download a copy of my book, which is a Stress-Free Lifestyle. It costs about $5, and enjoy reading that. At the same time, we would like you to please do subscribe to our YouTube channel so we can bring you many more interesting topics for your information. Again, ladies and gentlemen, I am Dr. NIK NIKAM. You are watching NNN Media, and we'll see you next time. Thank you.